On this edition of Cycle of Health, educating children with special needs, from allergies to autism, how one family navigates public school and proper health. Understanding prostate cancer. We'll show you how new diagnostic techniques are saving lives. And it's a woman thing, fibroids, endometriosis, and sisterhood. Learn why one woman's pain led her to help ease the pain in others.
Cycle of Health is made possible by our members
and by eye, plastic, and reconstructive surgeons of Central New York. Doctors Bersani, Hill, and Carruth specialize in cosmetic, facial, and eyelid rejuvenation tailored to each patient in their new facility in Syracuse. Why not look as good as you feel? EyePlasticCNY.com. And by the Central New York Eye and Tissue Bank. Every year, hundreds of organ, eye, and tissue donors save and enhance lives of people right here in our region. You've been given the gift of life. You can give it back by enrolling in the New York State Donate Life Registry. More information at cnyetb.com. And by SUNY Oswego, offering health-related graduate degrees and certificates, such as mental health counseling, health technologies, and an MBA in Health Services Administration. Courses offered online, on campus, and at the Metro Center in downtown Syracuse.
Welcome to Cycle of Health. I'm Susan Kennedy. Sophie and Danny are siblings, full of love and laughter and some special needs their school helps to handle. Our Dr. Maritza Alvarado explains how one family navigates public school and proper health.
When Danny was born, I had a sense that something was different.
Lots of fun.
Danny's nonverbal, he doesn't talk. Initially, he was diagnosed with cerebral palsy and a couple of other things that didn't really set exactly right with all of us.
Good job. Good job.
Some of the things that were causing him to fall and his uncoordinated movements, it turned out, in retrospect, he was having seizures. And so one night, I think in January when he was 4, we called an ambulance and realized that he was having seizures. And we met a physician who was the first person after 4 years to tell us, I know what this is and I can help him. And Danny was diagnosed with Lennox-Gastaut syndrome, a seizure disorder. Danny has asthma, and he's prone to pneumonias, and he's allergic to peanuts and tree nuts pretty severely, and soy, corn, and oats as well. Since we knew we had a child with a severe peanut allergy, we really were careful with the preschool, and we communicated really well when he transitioned to kindergarten, and talked with his special ed teacher and the special ed department and his aides, and really had everybody well set up for managing a child with severe peanut allergy.
You know, the first step was getting everyone together to see, you know, these are our problem areas. We need to sit down and figure out how we can, you know, fix them, but fix them in a way that works for everyone. Because it's not, you know, it's not just our child in the school, and he's in the classroom with other students. So, you know, all the solutions need to work for him, but also work in that classroom setting and work in the school setting.
We've realized that we can't manage this anymore on our own. We send our kids, both of our kids have peanut and tree nut allergies, and we send them off in the world, and there are certain things that other people need to know that they may not know going into it. We didn't know all this, you know, before we became the parents of allergic children.
So Sophie, you're Danny's little sister?
Mm-hmm.
And you have allergies too, don't you?
Mm-hmm.
Uh-huh. Can you tell me a little bit about that? What happens to you when you get your allergies?
When I get my allergy reaction, I get hives all over my body, and I get really bad itching.
And what happens after that? What do you have to do for that?
I have to use something called an EpiPen.
And have you ever had to use one?
Yes.
And what happened then?
You open one of them, and then you take one out. They take this blue thing off, and then put it. They wanted you to put it in the knee, but other times somebody was like rolled over and all that. I had to. We always did it like over here or here.
Okay. Very good. And do all your friends know about your EpiPens?
I don't think so.
Okay. What about your teachers?
They know about this.
And the school nurse too?
Following the Individual Education Act, the IDEA Act, we provide a series of services, and it's really individualized. So no two children really would have the same thing. We have to look at the individual child and the areas of disability and where they impact the student on a daily basis. So an individual education plan is generated through a committee on special education. After a student has been identified with a disability, we have to generate what's called an individual educational plan, which basically identifies the disability, the areas of the supports, the student's strengths, weaknesses, their levels of performance in the areas of academics, behavior, social, emotional, physical. I think one of the biggest challenges that we've seen in special education is it's not just a learning disability, it's coupled with a learning disability, and now we're seeing more kids that may have medical types of issues that get associated with that, such as allergies or some types of syndromes or whatnot, and we learn that by working with our medical partners out in the world of medicine, and then we try to take that information, you try and gather all that information to make the best decisions for kids. A huge effort with a lot of the other things that are going on in schools and all of those things is making sure that you drill down to each individual child to make sure that the services are provided in the best possible way. We're not the medical office, we're not the health office. We're the Office of Special Education that really focuses on, that educational impact, that disability's impact on the education piece. But you can't just have that piece. It's all of those pieces. All those needs have to be met to support kids' needs.
The more open and willing you are to talk about it, the more people that you'll find community with. And I think that as we have honest, open conversations with our schools, with the other parents, hopefully people will become more aware and more understanding.
Education statistics show that about 13% of public school students in the U.S. receive special education services. Now, 5 biopsies, 5, failed to detect Jeffery Barkley's prostate cancer, but a new diagnostic test finally found it. Dr. Richard O'Neill explains how these new tests are saving lives, lives like Barkley's.
This bear was shot in New Brunswick, Canada. It was shot with a rifle.
How big a rifle do you need to shoot a bear?
Any size rifle that you'd use to deer hunt with will adequately shoot a bear.
Is there a particular place you have to shoot it?
The best place is just like on any big game animal, through the vitals, try to double lung shoot them.
Approximately 10 years ago, I was going for my annual checkup, and my doctor noticed that my PSA levels were slightly increased, and it created a concern for him. I didn't know much about it at the time, and so every year we noticed that it increased noticeably. I had slight trouble with urination. My sexual life wasn't what it had been before, and I sort of wrote it off to, I'm getting old, everything's wearing out, nothing's working, and I just had a concern, but yet I knew there was something physically wrong with me. I could feel it. When it hit the index mark of 4, he suggested that I go and have a biopsy done. And each time I went for a biopsy, I was sure that they were going to come back and tell me, yes, you have cancer. And I was prepared myself to deal with that. And so it was really no surprise when Dr. Vourganti sat me down and said, yes, we found cancer.
What was it like for you getting the diagnosis?
My wife and family members were shocked. They were upset. They were scared. But I think I was already prepped for that.
So Debbie, what was that like for you?
That's when it actually hit me, and I mean, just the way that it would in anybody, you know, the door just closed in my face.
The vast majority of us men will develop prostate cancer if we live long enough, but it would never kill us. The word cancer, though, scares us into a lot of medical procedures that might very well leave us incontinent or impotent or both. Let's go talk to a medical professional about a possible new treatment option that might help.
The problem with biopsy is you put needles in the prostate and you're essentially doing a sampling. As biopsy is done without these new technologic refinements, you literally are just going to areas that tend to harbor prostate cancer. You aren't going to anywhere particularly suspicious or not. And what people have developed, and some have even gone as far as to call it a manogram, where you take a picture instead of just having this vague suspicion or risk category, or we have your PSA test. And so imagine a world where a woman would come to the doctor, get a blood test, and we're doing your breast-specific antigen test, and it's elevated, and we think that you have a 30 or 40% chance of having cancer. So now we're going to put needles in, we're going to put 12 needles around the clock face of the breast. We're going to pull them out and tell you if we found something. So what we do now is we perform these pictures ahead of time with MRI, and we find areas of suspicion and come up with targets. And we use refinements in technique with our biopsy technology and computing and the concepts behind GPS and 3D spatial accuracy, and we put the needle right in the spot.
It used to be a death sentence, a cancer. You hear the word cancer, and people thought, oh no, they're going to die. And it's not true nowadays. A lot of cancer can be treated. A lot of cancer can be dealt with, and you can even live with cancer for quite some time. And I can't stress to everybody, especially the fellows that I'm talking to now, I tell them over and over, involve your wife, your girlfriend, your spouse, your family with it. Talk to them, get them involved, get them educated to it, because that support has been tremendous. My wife has been by me through this thing thick and thin, and I would have had a difficult time doing it without her.
I love him for him. It doesn't matter. I love him with my heart.
Prostate cancer rates second only to skin cancer as the most diagnosed cancers found in men. And to talk more about technology and our hospitals is Derek Cease, Chief Quality Officer. Hi. Hello, at Krause Hospital. Welcome, and we're talking about technology because how do we know as a patient, though, Derek, if the latest and greatest thing is the best thing for us?
It's a very good question, and the answer can be complex, but I want you to think of some basic things. Because technology, obviously, we want to advance it. The assumption is that as we introduce new technology, it allows us greater insight in understanding the story around the illness or the injury or the issue.
Right.
But what's also important is not just the technology as it gets advanced, it's also the physician and the healthcare team back in the hospitals that know how to use that technology to get the most out of it. So using it for the first time versus using it for the 100th time, you know, in terms of, you know, hopefully better outcomes, the more experience you have with the technology, the better off it will be. But technology by itself is not the answer. It's a contributor to the solution. But the physician and the healthcare team are also part of that. And it's a combination of both the human knowledge and the human skill along with the technology. That's the critical factor, in my opinion.
As a patient, how do I know? Can I really ask?
You can certainly ask. You can talk to the physician. Yeah. The physician, particularly surgeons who are using advanced technology like robotics or whatever, they should have a comfort zone and an experience behind them that tells you that you're comfortable. And physicians are going to make sure that they provide a solution to you that they are also comfortable. The last thing they want to do is bring harm.
Right.
And there are times in which they will determine that this technology is better, and then lower or more tenured procedures that are simplified in the sense of not the advanced technology may be better. My wife's an example of that. They chose a less technologically advanced surgery over a more technologically advanced because that was actually the better choice for her.
One-on-one, consultation. I mean, it matters.
That's important.
Individualized care.
That's important.
So it doesn't always, but it can be.
And the physician's going to be your best partner to decide what is it that I really need to do in regards to that technology. Should that be a part of it or another procedure?
Or another way. Derek, thanks. Good advice.
Thank you.
Lena's monthly pain seemed worse than her girlfriend's. It took years of visits to different doctors to discover the cause, and years more to curb, if not cure, the pain. Dr. George Stanley tells us why fibroids and endometriosis are often tricky to treat.
She looked like a skeleton at one time, and she was so thin, and it was really, really, really bad.
It had started when I was in high school, and the periods were always heavier, and I seemed to be doubled over and missing school, which my team, everybody else wasn't. My classmates were not. It tends to be very heavy bleeding, and sometimes it gets stabbing pains, and they don't let up, and they don't back off. They just stay there. They don't come and go, so they're constant.
People think that endometriosis is always in the pelvis. Actually, endometriosis affects many parts of the body. Affects the bowel, affects the diaphragm, affects the lungs, lung endometriosis, affects scars of previous incisions in the abdomen, especially C-section scar. So it is a disease that affects several parts of the body and leads to symptoms that need our attention.
In conditions where women have infertility and endometriosis is a significant factor, what kind of treatment options do women have?
If you see endometriosis, you have to treat it right away rather than wait. So you schedule the patient for laparoscopy and the treatment, and then you see endometriosis, either you excise it or burn it with the cautery or use laser, CO2 laser, and ablate it. So you treat the patient at the same time you make the diagnosis, and therefore they go after that, try to get pregnant right away without waiting for a long time.
In your experiences for women who may have infertility, and then they do have surgical treatment of endometriosis, how do their chances of fertility improve?
Significantly, provided that you rule out other factors.
When I found out about the red raspberry tea and how well it worked, and I didn't need any pain pills, and I shot through radical surgery that I didn't need the morphine or anything in the hospital, and they actually kicked me out 2 days early. I was having fun with the nurses because I wouldn't stay in bed. I was happy, and I said I can take care of this at home.
I was diagnosed with endometriosis back when I was I was like 18, 19. They said, don't wait till you're old to have kids if you want kids. And I did. I've had 4 children, and now that I'm older, some things I'm like, oh. And the one thing that she recommended was the raspberry tea, and I take it. That's my ritual. I take that red raspberry tea, and my daughters too. So she's helped me, I help them, and that's great.
The whole herbal thing, you're talking thousands of books by this point. I mean, I had hit the library, ordered them. I was cramming at the health food stores. It was just, I couldn't learn enough. And herbs and vitamins and minerals are my specialty. They work best for me. For you, it might be vitamins and minerals, and you never leave them out because your body has to have them to function. You can't do anything. You have to know everything about whatever disorder you're treating and what's it missing.
Well, the one thing is the cramps and just the flow of everything. And the doctors, the first thing they say, oh, take Advil, that'll help. And it does and it doesn't. And, it gets to a point where to me, it's not worth it. And take that red raspberry tea, a strong dose, the organic, and it does help within maybe 15-20 minutes. You just start feeling better. It's better than a triple dose of Advil.
It's going to taste like a fine black gourmet tea, okay? And if you put anything in there, it slows down the action of the herb. It's one of the few herbs that you just don't mess with. Let it do its job. It also has B complex. It has phosphorus. It has magnesium. And obviously, being a food source, it's very easily absorbed by your body, so your body can use that magnesium. And one of the things that the alkaloid does, the fragrant, and the magnesium, is it calms down muscles and organs, and it's particularly effective on the uterus. So on the uterus, it just relaxes the whole thing. So 20 minutes ago, your uterus might have been doing the peppermint twist or the Watusi, but now it's not doing it anymore. Okay, and I was just like, I can't believe this. They've been giving me these high-potent drugs that didn't work, and I just found this tea, and that was the beginning of learning everything. I went 15 years afterwards because they said I would be dead in a month if I didn't do the drugs, and the drugs were making me worse. So I picked up on all the herbals and the vitamins and minerals, and for me, that was the way to go. My body popped right back up, and I turned it right around, and the next thing you know, I'm hitting the road again and going, yeah, I beat that.
Lena spent nearly a decade working at a natural market, guiding women with similar health issues. She now consults from home. And I'm joined now by Dr. George Stanley, Dr. Rich O'Neill, Dr. John Parker, and Dr. Maritza Alvarado. Thanks so much for all your help on this episode.
Thanks.
And we'll start with you, Dr. Stanley. Fibroids, endometriosis, you see this a lot in your practice.
We do, and one of the things that was great about this story is that when you look back like a generation, 25, 30 years ago, women only had surgical interventions that could be done. Now there's much more conservative medical treatments and other sort of non-traditional treatments that I think are a lot more appealing to women today.
That's great.
Do you find that we don't talk about it as women? Like we're supposed to get menstrual cramps, so how do I know that this is worse than the next one?
Right. I think, I think there's a lot of comparatives that people do, amongst family members, sisters, and that sort of stuff. Yeah. But when a woman's symptoms are outside of the norm of her comfort zone of her family members, then I think they should seek provider attention.
Mm-hmm, mm-hmm. And that's good advice. And then I turn to you, Dr. O'Neill, because in this episode we also talked about prostate cancer.
Yeah.
The diagnostic testing, and how do you know?
Yeah, it's tough because there's a lot of false positives with that diagnostic testing. So men are, of course, very worried, just as women are worried about not being able to conceive after having that kind of a problem. But so men are stuck there because they really don't know, should I have the procedure, because there's a downside to having the testing. So we have this emotional conflict to deal with. Very tough one to resolve.
And males, as a general rule, have a tendency to not want to go for medical treatment.
Yeah,
it's a denial across the board, board.
Yeah.
And then when you're talking about that particular aspect of the health, that's going to be even a narrow
very
border.
threatening.
Very threatening,
Yeah,
absolutely.
But
we don't want to know.
Right, exactly, exactly.
But you need to know, and that's for everyone's better health. And finally, Dr. Alvarado, special needs in schools and managing it. What a tricky situation that family has.
It is for them because their child, obviously, as you can see from the story, is non-vocal, and everybody in the building has to be aware of what's going on. So it's just that communication piece, making sure that everybody's on the same page, that they know what to do in case of an emergency. That's where the school nurse takes a very important role. Yeah. And that's where we need to focus our energies on is making sure that the parents feel comfortable when they turn their child over to us.
Okay, great. Thanks so much for your insight, everyone's insight for this episode on Cycle of Health. And on the next Cycle of Health, integrating East with West, a look at alternative medicine. First, melding meditation into your health and wellness plan. Dr. O'Neill gets guidance from a Zen master. And focusing on the power of touch. Dr. Alvarado gets a lesson on the art of massage. Honing in on herbal remedies as well. Well, sometimes it's nature's magic at work. Other times it's toxic. How can you tell the difference? And the business of mainstreaming alternative medicine. Does it compromise the Western treatments? We ask our panel of docs next time, right here on Cycle of Health. And that's it for this edition of Cycle of Health. For Doctors Alvarado, O'Neill, Parker, and Stanley, I'm Susan Kennedy. Go out and make the most of your Cycle of Health.
Cycle of Health is made possible by our members
and by eye, plastic, and reconstructive surgeons of Central New York. Doctors Bersani, Hill, and Carruth specialize in cosmetic, facial, and eyelid rejuvenation tailored to each patient in their new facility in Syracuse. Why not look as good as you feel? EyePlasticsCNY.com. And by the Central New York Eye and Tissue Bank. Every year, hundreds of organ, eye, and tissue donors save and enhance lives of people right here in our region. You've been given the gift of life. You can give it back by enrolling in the New York State Donate Life Registry. More information at cnyetb.com. And by SUNY Oswego, offering health-related graduate degrees and certificates, such as mental health counseling, health technologies, and an MBA in Health Services Administration. Courses offered online, on campus, and at the Metro Center in downtown Syracuse.